Today I'll be talking on the topic smart eating tips to ease GERD in patients with diabetes. If you have gastroesophageal reflux disease as well as diabetes, managing both conditions together is important to help you feel better and stay healthier. Here are some simple tips you can take to manage your condition. Healthy eating is very important for everyone. For patients with GERD and diabetes, it is important to understand how foods impact blood sugar level and which foods can trigger acid reflux. These foods should be avoided before lying down or exercise, as they can vary from person to person. Drinks like coffee, tea, cola, tomato juice, citrus juice should be avoided as they can worsen the symptoms by irritating the esophagus, a food fight that carries food and liquids from mouth to your stomach, or increase the stomach acid. The sugar sweetened drinks are high in calories and can increase blood sugar level, so it is best to drink them less often. The nutrient rich options like fruits, vegetables, whole grain should be eaten as they help to stabilize the levels of sugar, while refined carbohydrates like white bread, snacks containing sugar should be avoided. Patients should avoid large meal as they take a longer time to digest and it can put pressure on the lower esophageal sphincter and remove the muscle at the bottom of the esophagus. Also, eating during bedtime can be more likely to cause the reflux when you lie down. It is better to eat earlier in the evening so that there is enough time for the food to be digested before you go to bed. And you should try having your main meal at lunchtime and a lighter meal at dinner. Always eat in a calm and stress-free environment. Balancing the food and diabetic medicine is important. Too little food with medicines can cause lower blood sugar, while too much food can raise the blood sugar levels. So you should consult your doctor to coordinate the meals and medications. To balance meals, you can use the plate method, which help you to control the portions of food. Use a 9-inch plate filled with foods containing less carbohydrate, which include vegetables like lettuce, broccoli, green beans, one quarter plate with lean protein like fish, eggs, or beans, and the other quarter of the plate with healthy foods like fruits or whole grain. In some cases, patients with GERD may have a weakened lower esophageal sphincter. In these patients, lying down after a large meal can cause the food to return to the esophagus, leading to heartburn. If you experience heartburn, find out whether it happens after the meal, when lying in the bed, or after sleeping. Staying in upright position until digestion may help prevent heartburn. If heartburn occurs frequently at night, try raising the head of your bed or using a pillow to keep your esophagus above the stomach. Also, avoid physical activity after eating. Avoid drinking alcohol as it can cause the lower blood sugar, can cause low blood sugar shortly after consumption and for many hours afterwards. It may also trigger heartburn. Managing both GERD and diabetes together is essential for improving your overall well-being. By making the mindful choices such as eating balanced meal, avoiding trigger foods, and coordinating meals with diabetic medicine, you can maintain stable blood sugar levels and manage the symptoms of GERD. So here we come to the end of the topic. The references are mentioned: diabetic management, whole lifestyle, daily routine, how they affect sugar available. It's a widely available journal. Diet and lifestyle changes. It's another journal about GERD. Thank you.